If you have ever had malaria, then you know it's not a joke. I mean, one time you're feeling so fine, and the next time you're shivering like winter in Canada. Yes. So not to worry. I'm here to give you the ultimate guide to malaria. I mean, what it is, the causes, the symptoms, and how to treat it effectively. And most importantly, how to prevent malaria. Yes, first of all, what is malaria? Malaria is actually a disease caused by a parasite called plasmodium. Ah, but don't worry, the main criminal is actually mosquitoes. Yes, and not just anyhow mosquito. It's the female, the infected female Anopheles mosquito. You know that tiny. I don't know what to call her. She just suck your blood and infect and inject, the disease into your blood or stem. Yes. Now, all right. Now let's talk about the symptoms of malaria. First of all, we have high fever. Yes, one minute you're fine, and then the next minute you're shivering. You also have chills, like you're going to be shivering, like everywhere is too cold. And then severe headache, severe persistent headache. Like it's going to be so severe, like that kind of, my village people are calling me headache. Yes, that kind of headache. Now there's also muscle pain, like your bones and your muscles will be complaining, like what is this? What has gotten into my system? Yeah, your body, your bone is going to start complaining. Then extreme tiredness, like sleep is going to become your full-time job. You'll be sleeping like pregnant. I don't know what to call it, but you're just going to be extremely tired. Now another symptom is nausea and vomiting, like your stomach will start a protest you never signed for. These are all symptoms of malaria. The chills, the fever, the headache, the nausea and vomiting. I know that. Well, alright, let's move to the next thing. Now, how do we treat malaria? Yes, how do you treat malaria? Now, don't just go and get agbo or hospital is not far. What do they call that leaf? And take it and you feel like malaria is going to go. No, it might make you feel better, but trust me, you haven't gotten rid of the malaria yet. Yes, you still have that disease in your body. So, what do you need? First of all, before you even start any treatment, go to the hospital and run a test to confirm if you truly have malaria, because you can have all the symptoms and yet it might not be malaria. It could be symptoms of another disease. So go and run a test. Be sure. Malaria is a very common disease in Nigeria, that once you just start feeling headache and body pains, boom, they'll get you paracetamol, malaria drugs, this, that, this. No, go and run a test first to confirm that it is malaria before you start treatment. And then when you've confirmed, when the result is out and yes, you have malaria, you need to use artemisinin based combination therapy. That is the MVP malaria treatment. Don't go ahead buying Igbo, green leaf, herbal teas for malaria. You might feel better, you might feel relieved, but hey, the malaria, the disease is still there. Yes. Now the next thing you need to do is also drink enough water. Yes, because when you have malaria, you're going to be losing a lot of your diet. That causes the weakness. So you need to drink water and fruit juice to help replenish. Yes, keeps you hydrated. Now there are some food that actually speed up recovery if you have malaria, like fruits, vegetables, you need water, fruit juice, yes, and even energy giving foods like rice, and go with yam, potatoes, and all that. Yes, and then you also need protein. Yes, you need protein. But when we need protein, you're not taking heavy meals. Now, what should you not do when you have malaria? Yes, what should you not do? First things first, don't rely on local herbs, mixtures, stop it. Like I said earlier, make sure you go to the hospital to confirm that you have malaria before you start any treatment. Don't take random drugs. Don't just take random drugs, treat drugs, and so somebody say take this, you take that, take bubonishi, mix it with Felvin, or take bubonishi, mix it with Buscopan. Stop it. Like I said earlier, artemisinin based therapy, combination therapy. That is what you need. Now, another thing you need to know is that when you have malaria, it is very important you treat it fast. Once you're sure that it's malaria, treat it fast because it can get too serious and cause, a very severe disease in your body, especially for kids and pregnant women. Don't take malaria lightly. Malaria in pregnancy is very risky. So when you're pregnant and you have malaria, or your child has malaria, please treat it fast before it gets serious. A very quick one. Why do you keep getting malaria back to back to back to back? Yes, some people choose malaria almost every month, 2 times a month, some people even every week. Yeah, there are many reasons why it keeps coming back. First of all, you're not sleeping with a mosquito nets. Most Nigerians like to avoid it. We don't like nets. Even if so, I know it's not comfortable. It's not that comfortable. But try it. If you want to prevent malaria and you want a method that really works, mosquito net is very important. And then you need to make use of mosquito repellents. You can make use of insecticides when you know that your house has become a breeding ground for mosquito. You can fumigate the area or use insecticides. And then there are also some creams you rub before you go to bed. You can make use of them if you don't like mosquito net. And then next thing, make sure your environment is clean. Let it not be a club, like your house being a clubhouse for mosquito. By the time you're stocking dirties, spoiled food, these deaths that try to make this house flies, and then before mosquitoes start to breed in your house, and they can't have a VIP section in your house. And then stagnant water is also very important. That moment you finish washing clothes or washing the dishes, please trash the water in the appropriate place. Don't leave it there. Once it stays in your house or around your house, it's going to become a clubhouse for mosquito, and before you know, they get access to your body. Now the next thing is, another reason why you keep getting malaria even when you treat it is that you're not completing your medications. Your physician or your doctor told you to take it BD, like morning and night, for 3 days or for 5 days or for 7 days. But no, the first day, once you take that first dose and you're feeling okay, you feel relieved. It's not like you're actually feeling okay, you feel relieved, and then you just abandon your medication. And then before 2 weeks, you're having another. And guess what? When it comes back stronger and more severe. So make sure you complete your medications. When you're taking it morning and night, follow the routine. Take it morning, take it night, and take it for the number of days you were asked to take your medications. Now, another reason why you're getting malaria back to back is that you're ignoring prevention tips. You're not sleeping under the mosquito net, your environment is dirty, you're not using repellents, you're not fumigating your environment. Mosquito will definitely be your best friend. Yeah. So if you don't want all those things to happen, you should be cautious. Make your environment clean, try using mosquito nets or mosquito repellents, and then trash or dirty, make sure and complete your dose, complete your medications anytime you fall sick or anytime you have malaria. Make sure you complete your. Now, how do you prevent malaria how do you prevent malaria and avoid it from coming back, like disturbing your peace, disturbing your life? First things first, make use of mosquito nets. Very important. I will always emphasize on it. Mosquito net is very important. And then make use of mosquito repellents, even creams. Fumigate your environment. You can fumigate your house or your environment. For like 6 months, you don't have any business with mosquito. Especially when you're not doing anything that will invite them. When your environment is clean, trust me, you don't have any business with mosquito. So try fumigating your house if you can afford it. If you cannot afford fumigation, make use of repellents, insecticides, and then the creams to avoid mosquito from penetrating into your bloodstream. And then the next thing you need to do is clean up your environment. Throw away those stagnant water, throw away those trash once it's filled. Don't allow it to stay and then everywhere is stinking, and then the mosquitoes start having a clubhouse or It's more like a party in your environment. Now the next thing you need to do is wear protective clothing. Yes, especially for those that don't have mosquito net or don't like mosquito net, then you need to cover your body to avoid mosquitoes from biting you. Yes, it's going to reduce it. If you have socks, wear socks. Especially when you're sleeping in an open field and you know definitely mosquito will definitely come and kiss you. Make sure you wear socks, cover your leg, wear trousers, wear things that good, long sleeves to cover at least to avoid or to reduce the risk of malaria or mosquitoes from coming in contact with you. The next thing you need to do to avoid or prevent malaria is actually to take the preventive medication. Yes, take prevention medication. Now, the people will be like, why? Especially if you travel out, you travel a lot, you go to places, you go to rural areas where you know there are definitely mosquitoes there. Maybe you're going there for community service and all that. Make sure you take preventive medications. Yes, there are some malaria drugs that helps to fight against malaria even before it comes, not treating it, preventing it. So get some anti-malarial drugs, especially when you know you're not going to be, you're not in your safe or comfort zone. So when you're going out there for days, you're traveling, you want to visit your friends, your family members, you're going to the village for Christmas, make sure you take preventive medication against malaria. So my dears, malaria can be a very common disease, but now you have the knowledge to fight back. Yes, maybe you've heard what I've said one way or the other. You've heard some people like it's common, we hear it all the time, but trust me, a lot of people are still falling sick, a lot of people are still getting malaria because of some common mistakes they make. So I have talked about everything you need to know about malaria, which virtually everything. So maybe there's some things I missed out, but trust me, this is a complete guide to malaria, everything you need to know about malaria and how to avoid it and stop it from coming back. Now I would like you to share with me if you've actually had a crazy moment with malaria, because I do. Yes, I actually had a crazy moment with malaria. There was one malaria that actually struck, and it felt like I was in the middle of life and death. But trust me, I chose life. Yes, I fought it. I fought it. Like the malaria came with severe headache. Like I almost gave up. But thank God we are here today. And that is why it is very important. Malaria can look like a very common sickness or disease, but trust me, it can do a lot of harm. Yes, it can do a lot of harm. But meanwhile, I would love you to share your experience in the comment section, and don't forget to like this video, share to your friends and families. You don't know who will be needing this. Yeah, share it to anyone you can share it to your word, and don't forget to subscribe to my YouTube channel, Your Journey to Self-Care. See you another time for more self-care and health content.